Hello everyone, I'm Richard Conway from Dublin, Ireland, reporting for Room Now from EULAR 2021. I'm here to talk to you today about a study that was presented on Thursday. It was an oral presentation in the rheumatoid arthritis comorbidity and clinical aspects session. It was presentation OP0101 by Dr. Yoshida and colleagues. And this study was titled Rheumatoid Arthritis Disease Activity Over Time and Subsequent Cardiovascular Risks. So essentially in this study, the authors were looking at rheumatoid arthritis disease activity, how that changed over time and how that impacted on the cardiovascular risk of patients as measured by MACE, major adverse cardiovascular events. They had over 40,000 patients, and they measured disease activity using the CDAI, the Clinical Disease Activity Index. I like the CDAI. It is avoids inflammatory markers in its construction, meaning it's a good measure for day-to-day working, and it avoids untoward influences of certain medications on those inflammatory markers, which may not accurately reflect overall control of disease. So what these authors found was that a moderate or high CDAI within the first 6 months of rheumatoid arthritis treatment was associated with a significant increased risk of major adverse cardiovascular events. And that after 6 months, that increased risk appeared to diminish and essentially disappeared over time. And this is interesting. We know that rheumatoid arthritis patients are at increased risk of cardiovascular events, and we think a lot of this may potentially be related to disease activity, and that's what the author's findings corroborate that. But they also show that it seems to be early disease activity that is more important, and this has potential clinical implications. Obviously, we all have an inherent belief that we should treat our rheumatoid arthritis patients as well as quickly as possible. But this just further emphasizes that being aggressive and getting people rapidly into remission has potential benefits, not just to their symptoms, not just to their joints, but to their risk of comorbidities, and in particular in this study of cardiovascular risk. You can follow me on Twitter at Richard P.A. Conway, and remember to tune into Room Now for more news and information from EULAR 2021.